This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Dydrohope 10 tablet is an effective treatment for managing progesterone deficiency in women. It alleviates various reproductive health issues. Indications and uses. This medication is indicated for relieving menstrual pain, managing symptoms associated with endometriosis and premenstrual syndrome, and supporting overall female reproductive health. It is beneficial for women experiencing issues due to low levels of progesterone and is sometimes prescribed to alleviate signs of menopause when combined with estrogens. How it works. Dydrohope 10 tablet works by supplementing the body's levels of progesterone, improving uterine lining thickness, and alleviating symptoms related to progesterone deficiency. Directions for use. Take this medication as advised by your healthcare provider. It should be swallowed whole with a glass of water and should not be crushed or chewed. It can be taken with or without food, and it is recommended to take it at the same time each day to maintain consistent levels in the body. Your doctor will determine the appropriate dosage based on your individual health needs. Possible side effects. Common side effects may include severe headaches, nausea, breast pain or tenderness, and irregular menstrual periods. Consult your doctor if these symptoms worsen. Precautions and warnings. This medication should be used with caution in individuals with liver or kidney problems. It is not recommended for use during pregnancy or breastfeeding without consulting a physician. Always inform your healthcare provider of any pre-existing conditions before starting treatment. FAQs. 1. What is Dydrohope 10 tablet used for? It is used for managing progesterone deficiency states. 2. How should I take it? Swallow with water as advised by your physician. 3. What are the side effects? Common side effects include headaches and nausea. 4. Can I stop taking it if I feel better? No, always consult your doctor before discontinuing. 5. Is it safe for children? It should only be used in postpubertal girls if prescribed. Thank you for watching. If you have any questions or suggestions, feel free to leave a comment below. Your feedback is appreciated.